Hello everyone, my name is Beth McLeod and I am an FNP student at EKU. The clinical nursing question that guided my research is in pregnant women, how does a lifestyle intervention on diet and exercise compared to standard care affect excessive gestational weight gain during the antepartum period? Gaining too much weight during pregnancy can lead to adverse health outcomes for both mother and her baby. In 1990, the Institute of Medicine issued guidelines on adequate gestational weight gain to promote positive outcomes for mother and infant, and updated these guidelines in 2009 to reflect that over time, more women are entering pregnancy either overweight or obese, and many gain an excess amount of weight during pregnancy. According to the CDC, recent studies found that about one-third of women gained the recommended amount of weight during pregnancy, and most women gained weight outside of the recommendations. It is well documented that excessive gestational weight gain increases the risk of pregnancy complications that can affect mother and infant. These risks include gestational diabetes, preeclampsia, labor problems, C-sections, as well as increases the risk of postpartum weight retention and long-term weight gain, leading to overweight individuals. Healthy People 2020 set a goal of improving maternal and infant health and well-being by increasing the proportion of mothers who achieve the recommended weight gain during pregnancy. The purpose of this project is to implement a lifestyle intervention composed of diet and exercise counseling during the antepartum period to decrease the percentage of pregnant women gaining weight above the Institute of Medicine recommendations on gestational weight gain. The target audience is pregnant women, and this group has been selected because excessive gestational weight gain is a significant enough problem that a well thought out, developed, and realistic intervention needs to be implemented that will help improve the well-being of both mother and infant. Nurse practitioners play a critical role in the management of excessive gestational weight gain. Incorporating these lifestyle interventions into practice requires improved knowledge and skills on weight management and physical activity, and an increased level of comfort discussing these sensitive topics by nurse practitioners. Lifestyle interventions delivered by nurse practitioners increase healthy behaviors and reduce chronic disease such as preventing weight gain. Synthesis of the included literature suggests that utilizing lifestyle interventions such as diet and exercise counseling can decrease excessive gestational weight gain. The 4 included studies utilized random control trials. Each study was similar in that the diet components explained generalized topics such as healthy nutrition and provided personalized feedback. One study, slightly different approach, had patients follow the guidelines to a modified gestational diabetes plan, but still included generalized nutritional counseling. Each study had similar discussions on frequency, intensity, time, and type of criteria for physical activity, with each recommending a minimum of 30 minutes of moderate exercise multiple times a week. One study went a step further and explored the difference in excessive gestational weight gain between participants performing low-intensity exercise versus moderate-intensity exercise. All 4 studies concluded that the intervention group had a significantly lower prevalence of women exceed the 2009 Institute of Medicine's guidelines compared to the control group. Additionally, literature suggests pregnant women appear to be more motivated to implement lifestyle modification suggestions compared to other stages in their lives because of the concern of their fetus. Pregnant women who received physical activity education from health professionals during their prenatal appointments increased their motivation and readiness. The lifestyle interventions provide non-judgmental, individualized weight management counseling strategies that reduce short-term pregnancy complications and long-term associated postpartum weight retention and obesity. The proposed lifestyle intervention will take place in an outpatient obstetric clinic. Potential pregnant women participants will receive individualized lifestyle intervention focusing on diet and physical activity, consisting of 3 counseling sessions lasting between 30 to 60 minutes at 12 to 15, 16 to 18, and 20 to 24 weeks of gestation. Each session will include 10 pregnant women for a total of 10 rounds to have 100 total participants. The principal investigator, which is myself, will give the counseling sessions. During the initial meet, participants will be checked against inclusion and exclusion criteria. Informed consent will be obtained, as well as stated pre-pregnancy weight for the first set of data collection. The first counseling session, participants will be informed of the Institute of Medicine's recommendations for gestational weight gain and a target set. The second counseling session will discuss physical activity and exercise related to pregnancy. Cardiovascular and strength training exercise at low to moderate level intensity will be shown and performed. An exercise ball will be provided to participants during the session. Posters from the American College of Obstetricians and Gynecologists, also known as ACOG, will be on display, and exercise pamphlets will be provided to participants to take home. The third counseling session will discuss nutrition related to pregnancy. The dietary component is designed to increase awareness of food choices, discuss basic nutrition principles, and advise about critical nutrients in pregnancy. Recommendations on limiting snacks and increasing water, vegetables, and fruits will be discussed. Pregnant women will learn about the risks of alcohol and foodborne infections during pregnancy. ACOG pamphlets on nutrition and obesity will be provided to participants to take home. Gestational weight gain will be measured using the patient's stated pre-pregnancy weight and subtracting her weight on the day of her delivery. The weight from day of delivery will be obtained through electronic medical records. The measurable outcome will be the proportion of pregnant women exceeding the weight gain recommendations of the Institute of Medicine. A chi-square test will be used to test for significant differences in percentages of participants within recommended weight gain ranges. The data collection and evaluation will happen approximately 1 month after the 10 round of counseling sessions are completed. It is the hope that as a result of this proposed study, there will be a decrease in excessive gestational weight gain amongst pregnant women receiving diet and exercise counseling during their prenatal visits, and overall promote a healthy lifestyle and improve health for both mother and infant. Thank you.